The offers are good enough to attract pretty much everyone who sees them. Career postings for nurses touting six-figure pay, $50,000 signing bonuses, and thousands of dollars in educational assistance. But the incentives don't seem to be enough. Enrollment in baccalaureate nursing programs down for the first time in 20 years, and more than 100,000 nurses have left the workforce since the pandemic started.
I've never seen a moment in time that is more important for our country and our communities to support the nursing profession.
Kate Judge, executive director of the American Nurses Foundation, calling the current stress level among nurses sustained and concerning. The U.S. Bureau of Labor Statistics projecting more than 250,000 additional nurses will be needed now through 2030. A recent survey by the National Council of State Boards of Nursing says burnout concerns were seen most in nurses with fewer than 10 years of experience.
Thank you all.
Democratic Rhode Island Congressman Seth Magaziner introducing the Healthcare Worker Retention Act this past February. The bill, if passed, would establish through next year a $1,000 refundable tax credit for healthcare workers who meet certain criteria. The bill was referred to the House Committee on Ways and Means, where it still sits. Despite short-term incentives in the works from lawmakers,
Ultimately, it's about what is sustainable in the workplace.
the ANF is taking a more in-depth approach by working directly with nurses at Indiana University Health and 3 other hospital systems elsewhere in the country to adopt the Stress First Aid Program. It was initially designed by the U.S. military to provide a framework for psychological peer support and ways of promoting self-care. Christy Todd, a nurse of 23 years and current clinical advisor at IU Health Bloomington, is helping lead the charge.
It ties together what I feel like a lot of us are already doing in our day-to-day practice and working as a team, but it helps us have a common language.
They use a guide called the Stress Continuum that's divided into 4 different colors: green, yellow, orange, and red. Green, meaning a nurse is having a great day and in control, all the way to red, meaning a nurse needs immediate intervention with a mental health professional and should step away from work. That's also the point in which the team should reach out to hospital leaders for additional support. Todd admits self-care is important in any profession, but for nurses, it's an especially taxing occupation.
But our industry is unique in that we are dealing with high emotions, high stakes, and wanting to do the best to care for our patients.
I'm John Paul. Thanks for watching. Here's another video for you to watch. Also, please take a moment to subscribe to our channel.